this is changing. So let's talk about some implications of this. I like to characterize there as having been three modeling eras. The first of these modeling eras was really probably started in about the 1960s or so on. Before that, in the military area, but for growing used to modeling in the 60s, where it was very much a model. The model is to basically say, okay, consult us, describe your problem to me. I'll go off and create a model, and I'll tell you what to do. And that was a very arm's length sort of relationship, and frankly, one that left a lot of room for misunderstandings, for problems, and it didn't really build capacity on the part of the stakeholders, the folks who were involved in the modeling. Often they wouldn't even be able to use the model. It was just they depended on this person to give them advice. At a later phase, and this is actually the dominant phase right now, even to this day, models are built and distributed as black boxes to a team. The team that gets them sometimes doesn't understand what they are, or they're used by one person on that team without others really understanding them fully. And this is actually very common in certain areas. In Canadian context, we have models from StatsCan, the equivalent of the Census Bureau, which are very powerful models, but the people who work with them really don't understand them. And there's a very good reason for that, is they're not created in a framework that's transparent. It's not created in a framework that's designed to communicate to less technical people. And as a result, when people use these sort of models, they're used in very limited ways. You can only use them in very scripted sort of fashion to ask these sort of questions. You plug in numbers here, you plug in numbers there, and it puts out some results. And it's a disconcerting thing for the stakeholders because they don't know exactly what's being assumed sometimes in this model, and there's very limited options. To get it extended, to be able to ask more general questions, you have to go back to the modelers. And you have to do that for even small requests. So here we have sort of a slow exogenous model evolution. It's not as nimble. It's not as much of a learning tool. You're not able to sort of learn it and update it whenever you get new insights. It's more of a laborious thing. What I've been sort of adhering to in our work, particularly in the past 5 years, and what a growing number of modelers do undertake is what I like to call agile modeling. It sounds a little bit of a buzzword, but I don't have a better name for it than that. Sometimes you call it team-based modeling, collaborative modeling, adaptive modeling. The basic idea is that the model is used in a rich way in an interdisciplinary team. The model is built sitting alongside end users, sitting alongside people from all sorts of backgrounds. You can build up models where the person who has their hands on the keyboard the most is surrounded by people from whatever background who really understand what's being built. They look at it and they understand the decisions that are being made going into it, and they shape those decisions. The model is relatively transparent to non-modelers, and those non-modelers can often use it quite flexibly because they know how to run it, they know how to change small assumptions about it, they know how to request a little bit more data from it or what have you. And the end user increasingly can customize some of the outputs, although we're working to enhance that. And the model here is very much a living document. It's evolving with the learning. It's not this crystal ball that you've hired someone else to build and now you depend on. Rather, it's something that's being built inside the group. And you'll recall this notion that I advanced this morning of models as thinking tools. These are these thinking prostheses. They help a group. It's not just one person, but a group sort of learn from the latest evidence, discuss that evidence, what its meaning is, and hopefully it's not just one model, but several models, and sort of competing models, and models which depict different components of the system. And this is about putting whatever evidence we do have to test. Now, ladies and gentlemen, I should tell you something. I told you this morning, I had a confessional, I realized at one point that data doesn't come from heaven. But I also realized that qualitative comments and observations don't come from hell. So there's a lot of wisdom that people who work within a system, come to understand that transcends sort of figures, transcends numbers that they can write down. They kind of get a feel for what patterns they see. And often some of the most valuable input you can get from those in an interdisciplinary team is to get them to kind of look at the model and take a look at its results. And does that seem representative of the sort of things you see, not only in terms of the actual data you do have, which is great when you have it, but in terms of the sort of the phenomenology, sort of how things work in the system, the sort of daily caseloads you see, the pulses of caseloads after weekends or whatever it is. These features that you may not have a lot of data on, but which people develop an intuition for. And sometimes people say, that doesn't look realistic to me. And they can give real effective feedback there in a way that's not limited to sort of saying, I have data on exactly this thing. They just say, that doesn't hold true to my experience. This is really a really valuable thing. So when we talk about empirical evidence, I'm not talking about strictly things that come out of a systematic review or out of Cochrane collaboration or something. I'm talking about things that are observations from people who are in the trenches working within the system. And we find a lot of this in our work, like with our Ministry of Health. There's a lot of things which aren't written down. The things that are written down often aren't that accurate. They're not that representative of really what they're aspiring to include. And so a lot of the time, people's observations end up being more closer to what you're seeking for. And you remember this coevolution idea, evolving the mental model here. So, generally speaking, it's often the modeling process rather than the model that offers the greatest value, and rather than even the suite of models. Modeling, I've talked about, as theory building, but it's also refinement of your mental models. So you capture this theory in the model, sort of how we think things might work. It's a theory. It remains to be sort of to have confidence built in it, and at the same time, you're refining your mental model along with this. Now, this is really important, though. I want to emphasize that discussion we had last night. There's only a couple people here who were there at that discussion. We had a wonderful discussion with folks working in the community, and very thoroughgoing. And I would hazard to say, Connie and Cassandra could comment on this. I would hazard to say that even Cassandra, who had the tremendous knowledge of the local context and the CVRC and how things work in this area with respect to delivery of services for infants and children, you learned quite a few things about that meeting. Just discussing, the discussions which go into what needs to be in the model. How does this work in our system? It causes a lot of group reflection. And what we found is that, often there are folks, sometimes they're clinicians, often they have MDs after their name, and they strut in there and they say, it works this way. And, someone will pipe up, maybe it's a nurse or an allied health professional, and they actually know really what's going on the ground in certain areas a lot more, and they'll say, well, that's the theory about how it works, but actually what really happens during the crunch periods is something like this. And it's not according to scripted plans. And so you find, there's different ideas that come out, but there's more fulsome discussion about and reflection on what we know, what we don't know, what we can be confident about, what we should learn more about, who we should ask for insight into this. And so it's basically a group discussion where people come away with better understanding about what's going on, quite independent of that computational model, quite independent of the model that comes out of it, or the models. It's a matter of kind of group reflection, retrospection, comparing of perspectives on it. including what's known, what's not known, what could be a priority for data collection or for further inquiry, et cetera. And this process is often extremely valuable. Even coming up with standardized ways of terminology. I don't know if it's anything like our province. So it's a humbling matter. Our province's population is maybe less than that of the metro Fresno area. So we have a population of about 1 million. I can only imagine within our province, we have different health regions which have different inconsistent definitions of, say, what rehabilitation is. That someone's in a rehab facility, what does that mean? Or convalescence, how exactly that term is used. And you find people from different health regions using incompatible terminology. And when you're building a model, sometimes you shed light on these things, and you sometimes get moves to standardize some of the terminology, to refer to it in a common way. So we particularly see this for alternative levels of care with respect to patient flow coming out of a hospital. So we've done a lot of work with stakeholders which have spanned the spectrum between, all of it has involved stakeholder involvement for these projects, but some of it, the model is built and kind of shown to people maybe along the way, and they give feedback. But quite a few of these models, and these include models built with NIH scientists who are actually embedded as intramural researchers at NIH, people with our Ministry of Health who don't have a modeling background, who are health scientists, but they sit with our modelers and they're working alongside them, and they provide that feedback. They look over their shoulder and say, that isn't how I think it works. We should really talk with so-and-so to get confirmation. And that's really on this sort of this group model building side. And it can be a very, very powerful process for reasons that I'll be talking about, even beyond sort of getting an accurate understanding. The idea here, and this is some terminology that came out of Peter Hovmand's work. I was alerted to it by Peter Hovmand's work. It's models as boundary objects. The idea is that look, you have all these people from different backgrounds. Like, gosh, in the same room. Can you imagine it? You have computer scientists, and you have folks from social work, and you have folks from criminal justice side. You have folks who are MDs. You have folks who are involved in the rehabilitation medicine, or other folks involved in physiotherapy or what have you. And we all come with our jargons. We all come with our cherished prejudices. We all come with our sort of our own little ways of referring to things. But what the model depicts within it, sort of its depiction of the situation, all of us can understand. So we can, even though we may speak in somewhat different languages, we can kind of point at places in the process and have a common understanding of what's meant by that. Oh, that's the place where, that's the point where someone is discharged to a long-term care facility, or that's the point at which someone is referred, is court ordered to seek clinical involvement. We can use the model as kind of this boundary object to talk about and to point to in ways that have shared meaning. This is a technique of using a model as a boundary object is something that's really been emphasized in Peter Hovmand's work, and we've applied it within the agent-based modeling area as well. It's a very powerful technique, but it's made possible by the sort of very graphic nature of a lot of these models now. In system dynamics, the models have often been visually simplified enough that they can serve as strong boundary objects. Some people relate to them more than others, but people can generally understand what they depict. And causal loop diagrams can be understood very quickly. Do you remember those diagrams I have with the loops, with the plus sign next to arrows and the minus sign? Those things can be understood very, very straightforwardly by those from many backgrounds. And even stock and flow diagrams, these things that I showed, remember with allostatic load and with the buildup of stress and with blood pressure, those things can also be understood by many people. Often what you'll have here is a participatory model building session where you'll meet with a group. Maybe it's a group of high school students. Maybe it's folks or community representatives. Maybe it's clinicians, but they're not modelers, that's for sure. But they all get together and they jointly help contribute to building up a model. So, I use diagrams like this very freely with clinicians, and they're not phased at all. And similarly, diagrams like this where we have stocks and we have flows between them. And they can communicate very comfortably with these sort of ideas. Yes, question? Yeah.
Is there a number that's more efficient?
Yes.
Higher or lower?
Yeah. Yes. So there's a literature on this. And my thought is that, up to a group of about 10, it's pretty comfortable. If you go beyond that, you can do it. And Peter Hovmand does do it, I think, with classes of 30 or something like that. But it's a little bit more, it requires, one of the things they do, if you start getting larger groups, and this is really emphasized in the group model building literature, which I haven't been a sort of a huge formal follower of, but it's very substantive. But they have scripts that they get into after a certain point where to kind of keep things all in order, you actually go in with a kind of a game plan of how you want to follow things, so that all of they'll typically be for a larger group, sort of people helping facilitating it from many angles. So there'll be someone who maybe is taking notes by creating the model while other people are talking. There'll be someone else drawing on the board. There'll be someone else who's watching the time. There'll be someone else sort of facilitating the discussion. And so you go in with different roles for a larger group. And there'll be someone who's also sort of, and maybe it's the same person managing the discussion, but basically who's helping to make sure you don't go in a rat hole for too long. So there may be one person eliciting things, but someone's sitting back there and sort of stepping, okay, let's keep things in perspective. We spent the past half hour talking about, the exact handoff between caseworkers in different counties. We only have 2 more hours. Do we really want to spend a lot more time? So often you'll have a group which can handle it more effectively, and they all go in with some scripts, some ideas about, okay, how are we going to use this time, so they all have a common understanding from which to depart. So the literature there's a very good book called by Jack Venix, Vennix. Jack is his first name, J-A-C. He's from the Netherlands. And it's called Group Model Building, and that can give you sort of more specific information on that front. It's a very nice exposition. Recent advances have permitted doing this sort of thing for agent-based modelers, and I'm showing here some of our more sophisticated agent-based models. You just saw some very, very simple ones. This is actually a more sophisticated one, which involves many sort of moving parts. This was actually for the deer movement and so on, but you'll see it consists of many pieces. But it's very graphical, and you'll notice that they're labeled with things. So this is representing deaths due to hunting, for example, and deaths due to natural causes up there at the top, or predation, deaths due to old age of deer, deaths due to chronic wasting disease. Things are labeled, and after a bit of explanation, you can often follow things like this. This is some project for a project that we were doing with Ministry of Health, and these are various states people could be in, and this from this model for for kidney disease and diabetes. This built by the student who's now in Alberta, incidentally. Couple of Statecharts we can have, and this is the process flow modeling that I was talking about for admission into a facility. So these sort of agent-based models are now quite accessible. I do want to highlight this, and I've got to wrap up here soon for this particular talk. But one thing you should understand, and frankly, it took me years to really fully appreciate this. This diagram, which is from Peter Hovmand, but adapted from several sources by him, shows different uses of modeling. And if you go to the modeling literature, you'll find dramatically different ways where models are used. And I talked about some of them earlier, this sort of list of possible uses of modeling. But broadly speaking, he classifies models according to what degree they aspire to capture how things are out there versus how people see things as being. And conversely, to what degree they're dealing with sort of optimizing the current system rather than radically rethinking the current system. And you'll find models in all of these quadrants, models that focus on coordination problems, where a lot of the issue is not how things are, but how people think things are, and that leads to different subgroups clashing. It may mean certain health professionals don't see eye to eye, and therefore the information is not passed smoothly between them. A lot of it is about how they see the system, and that's something you have to deal with to solve the problem. It's not a matter of simply characterizing it and knowing exactly what to do. It's you've got to persuade people that there's something to be gained by working with this other group. And we've seen profound cases with this. When 20 years ago, we were working in the area of education policy, and one of the most profound things that happened with some of our modeling was there was a university system in the States, southern part of the States, I won't use the name, where there was a chronic problem because the university felt that they weren't getting their fair share of state funds. And they felt that what was going on was that the K-12 system was capturing an unfair fraction of those funds, and they should really be going to the university. And they were constantly working at loggerheads with the K-12 system. They were arguing that they deserved the funding and K-12 was unfairly getting the lion's share of it, et cetera. And doing the modeling work with them, one of the things that they discovered was that they were actually putting a huge amount of collective resources. If they really total it up, as the modeling could help them do, a huge amount of those resources were being put into dealing remedially with issues that should have been dealt with at the K-12 level. So fundamentally, they would actually benefit from bigger investment in K-12 because it would spare them the need to clean up after the K-12, the need for remedial courses, et cetera. So they actually ended, after this modeling contract, they actually ended up going before the state legislature and jointly arguing that education as a whole requires more investment and arguing for additional money for K-12 rather than working at cross purposes with them. This is what I'd call, in a way, a coordination problem. It's people working at cross purposes, and it requires a somewhat different approach to the modeling in some cases. There's also learning problems that facilitate how to on the learning front, restructuring problems or analysis problems. So these are different ways models can be used, and some are more incremental, tinkering around the edges, and some are more radical in terms of designing things. Now, why involve stakeholders in the process? I don't think this is something I need to talk with this group a tremendous amount about. Probably you folks feel this in your bones. For many modelers, it's a bit of a foreign concept. Many people are more technical. Many people of my ilk, of my kind. So not all computer scientists are quite like me. Talk it up to me being left-handed. I don't know. But what I will tell you is that for many modelers, the impulse is, I'll go create a model for you, okay? And I'll go create it and give it to you. And the fact is, having stakeholders all throughout the process involves sitting next to you, working alongside you, discussing it with you, seeing it as you run these things, giving feedback as to whether it's realistic. Turns out it's hugely helpful. One thing that's maybe obvious is you get more information about how the system actually works and how people think the system works. And you can help bring out disagreements between different stakeholders, which is sometimes helpful to understand why you're getting different information or cross lines from different people. But another thing is that you you also are building capacity to use the model. They know how to use it. They know what it's used for. They actually can use it. They can run it. They can change things. They can modify small assumptions, etc. But you're also going into an environment where they're going to have a lot more in the game. They have more invested in the model. It's partly their model. It's not your model anymore. It's their model. It's our model. It's jointly our model. And so this can help, in fostering stakeholder cooperation down the road. And it can help motivate for them, why we have to collect certain data. If you come to them and say, well, my model says this piece of data will be most important for knowing whether we should do A or B in terms of be very, very important for knowing the outcomes of this program, that's a certain level of evidence. But if they've seen that working alongside you, they're going to be more invested in it. It can also help to keep the model updated and empower sort of self-guidance and movement to those people of the model. Peter Hovmand talks about the dignity of risk. The fact that, look, if you're modeling the system which involves caseworkers, shouldn't caseworkers be at the table? If you're modeling things that are going to affect people's lives, isn't there a case to be made in this day and age, particularly of patient-oriented research and so on, that we should give those folks the dignity of a voice? And I also think that there's a very good argument for this. The last thing I'll just mention here, and we do have to move on to other topics, is the profound viability of pursuing this work in communities you never would have thought possible. This is not a matter of going to college-educated people and engaging them only. This is not a matter that, you can't bring it to someone who hasn't, who has never taken a stats course. You can actually take them all to all sorts of places and get understanding. And this is a case from Peter Hovmand showing his work in India. He's worked overseas in Mongolia, India, and this was actually a case, this one here, where it was snapped live. They were discussing, these are causal loop diagrams up here, and those causal loop diagrams, as I understand it, appeared in both English and Telugu, which was a local language. And during this session, this was an all-male session. So these males in the village were talking with the modelers about why the environment is degrading and how that ends up impacting the availability of water or what have you. It ends up affecting their livelihoods. And this woman came into the session. I think she was looking for one of the men. And she actually sat there at the back for a minute or two and was looking and was hearing them discuss. And then she came up and started to modify the diagrams. She said, you actually haven't added, you need a connection between this and this because you're neglecting this effect of these cows that we brought in from the international market. They're much more water hungry. So you really need to put a thing between, cattle use and water shortage or what have you. So she started to get involved in this diagram just on the fly. She had enough sense about what was going on and how to label things that she was able to jump into it. This person who had previously been without a voice was suddenly able to contribute. So, these models may look really fancy, but don't get fooled that you need a fancy degree or many years of experience to use them with people, or that those involved are somehow only to be a subset of the villages. So Peter does a lot of work, and I would think that with this group, it might be particularly valuable to sort of clue into some of his work, and especially with his social work background, he'd probably understand a lot of the challenges. I should mention that I served on the committee of a student of ours, and a student from Aboriginal background within our university who was also from social work background. She was getting a degree in community health and epi, and she focused on participatory modeling with her Aboriginal communities. Found it a very powerful technique for eliciting understanding of people's understanding of tuberculosis care within the context of our province. So very effective. Yeah. Yeah.
Is really not the issue, right? And like, I'm thinking
Right.
about charrette,
Right.
right?
Right.
And
That's right.
you bring community people together to map out a problem.
Yep.
And the accuracy of how the problem is defined or described
Yep.
is not as critical
Yep.
as it is reaching some kind of consensus on how to fix it.
That's exactly right, and that's what. And somehow I missed the slide in this walkthrough, but that's exactly what that diagram that sort of characterized these types of problems. That's right, versus like a coordination problem. A lot of the issue here is motivating the will within the group to sort of to address the problem. But you know, it helps a lot if you've had diverse stakeholders, and there's some really neat modeling work in this area that goes back 20 years ago or something, where you have diverse stakeholders from different backgrounds who come together for the same modeling project, and because they've all been contributing to it, although they have very different perspectives, they all put much greater confidence in what the model seems to suggest. And often what happens, Cassandra, is not that the model actually isn't totally completed in these sessions. It's sort of people get their voices heard, their understanding, but actually there's some further work that goes on to sort of finalize it and everything. It's just that they've now feel more invested in it, and they feel more sense of buy-in to it. And as a result, it's brought them closer together towards a potential solution. So it's not merely a sort of an exercise to sort of talk about views. What does come out of it is a runnable model, typically. A model that you can ask questions, what-if questions of. It's a model that has a credibility with the different stakeholders across the board that it wouldn't otherwise have.
Yeah, I'm thinking of this on multiple levels. Even last night when we were talking about the configuration of our cohort, Connie, and how we recruit people in and all of that. And I'm just remembering that in our early planning days for mental health training, we actually had a training council of providers, right, that actually developed, Christy was on it, right, that developed that initial training process. And now we're sort of stumbling through the cohort we have right now because we didn't really do that on the front end. And so I'm applying your concept to other
right.
opportunities to problem solve in this arena.
Right.
This is tied into what we helped us with in the past. Our community is going to reflect its practice.
Right.
We want to use help to do. This is reflective practice with pictures.
That's right. That's exactly right.
And reflective practice, we have, what if? We have what if is a picture.
Exactly.
Wow.
That's exactly right. I think that's a very good way of seeing it, and I think asking what ifs with the pictures would not hold water probably if they don't know what's behind the pictures, right? They don't know the thinking that kind of went into them. So having had that dialogue lends the pictures a sort of weight or significance, or it changes their feelings with respect to them. So yeah. Right.
And that's kind of what you talk about.
Yeah, I'm sure I could learn a lot from you folks in this area, but it is an area where I think it's very promising for modeling, and I wanted to highlight this. You'll see plenty of talks about modeling where people don't talk about this aspect of modeling, but I do think it's one that has great promise and potential, and that could tap into your folks' wisdom, as developed from the reflective practice more generally by applying it to this area. And, it's work in progress. There's lots of exciting stuff going on here. Okay, so if it's okay, I'm gonna go on to the next slide. Any other? Okay, so that's great.